Hey there, friends. Dr. G here. A little bit of a different presentation today. Uh, we have symptoms in the house, so we actually got tested for the coronavirus, and hopefully we're all negative, and we'll be back in the whiteboard space soon. Regardless, I thought we'd finish up Chapter 11, Bacterial Diseases in the Digestive Tract. We finished up uh, last last time we talked with E. coli and the idea that there are specific strains of E. coli that primarily because of the plasmids that they carry are really nasty, and most E. coli is not going to be an issue. Uh, so just moving on, this is Helicobacter pylori, which is really an interesting bacterium in that it is the primary cause of gastric ulcers. And for a very long time, it was thought that ulcers were caused by uh, specific acidic foods and that you had in stress and dumping lots of acid into your stomach. But it turns out that there is this bacterium that actually can adhere to the mucosal lining of the stomach. And it begins to generate cytotoxic activities that creates inflammation. You end up um, essentially dissolving the mucosa that is the lining of the stomach that is preventing um, the acids that are in the stomach from getting into the cells and eating them up and giving you an ulcer. And so Helicobacter pylori is actually responsible for esophageal ulcers, gastric ulcers, duodenal ulcers, and uh, it is treated now with antibiotics, which is actually kind of an amazing thing in that you can treat ulcers with antibiotics rather than trying to live with it. And essentially, what people were doing was just um, reducing acid in their stomach to try and uh, eliminate the damage and waiting it out. But antibiotics work much more effectively. So what we're doing here is a screen capture that I can point to and talk at, and you just don't see me. And I don't know. Uh, I took a shower today though, so I'm clean, but I do have a hole in my pants. All right. So another bacterium that is fairly common in terms of its disease, again, primarily diarrhea, uh, bloody stools though, so it can be fairly serious, is the bacterium Campylobacter jejuni, and it is a spiral bacterium, microaerophile, meaning that it is not really um, an obligate aerobe, and it is found primarily um, in animals, poultry. Uh, it can end up also in dairy, primarily because of the infections that are occurring and passing it around. It's not really doing anything to the animals, but it can have some fairly significant effects on humans. Um, it's rarely fatal though, so there you go. Um, Another bacteria that is important to think about is Listeria monocytogenes. This is a gram-positive bacteria that can actually move around. It's a facultative anaerobe, uh, meaning that it's able to grow in areas of low oxygen. It's fairly lethal. Interesting thing is that it is psychotropic, or psychotrophic. That's what the word is. Meaning that it can grow in cool temperatures. It's able to grow in the refrigerator. So a lot of people actually are carrying it, uh, and it's not invasive. Um, but then it can also uh, make its way from the gastrointestinal tract actually into the rest of the body. And then you can have some very serious problems by the fact that it can actually invade through the intestinal wall. And that's going to generate uh, bacterial sepsis, um, meningitis, as it gets into the nervous system of the brain, spontaneous abortions, all kinds of nasty things with this one. And so Um, it is, again, another reason that sanitation and proper handling of food is so critical. Um, Another bacteria species that, if you were on a farm, particularly a dairy farm you may know of, is the species of bacteria called Brucella. And this generates a disease called brucellosis that um, you can actually get by consuming raw, unpasteurized milk. It is a kind of bacteria that might end up actually uh, being chronic. But you can then end up with a variety of generalized systems because it is, in fact, spreading throughout the body. And it can generate uh, sort of flu-like symptoms, fever, muscle joint pain. You generally will have some GI symptoms, but not always. Uh, Arthritis, back pain, meningitis. It can then even make its way into the heart and inflame the lining around the heart and cause endocarditis. So it is an issue. Um, Herds of the animals, cows, goats, pigs, can be vaccinated, and um, generally, that I guess the cows are infected, um, you will go ahead and put them someplace else, maybe kill them. So it is avoided by drinking pasteurized milk and not consuming raw milk. So lastly, um, we have a bacterium that if you work in the hospital setting, you may be familiar with. This is something called Clostridium difficile. And Clostridium difficile is found in uh, the gut, and it can produce extreme diarrhea and actually cause a range of um, colon issues and sort of ulcerative colitis and inflammation of the colon lining. Gram positive, it's an obligate anaerobe. That means that it is going to be found deep inside the intestine where there's not a lot of oxygen going on. And Clostridium can be passed around. It also can uh, get a foothold in terms of the amounts after antibiotic use. And so it's a fairly nasty and severe bacterial infection. It's also pretty easily spread. So the spores can be ingested by susceptible patients, and the spore germinates. Um, you can have for a while an asymptomatic uh, carrying of the spores, and when the normal gut flora are present, the bacterium is not going to actually thrive very well. But when uh, antibiotics are taken and various kinds of things like through bowel surgery, uh, different uh, drugs will allow the organism to multiply, and the toxic load increases, and then we end up with diarrhea, and bacteria spores begin to grow at pretty high levels and found in the feces. And so then they get dumped in the environment, and it's possible to pick them back up. So we got a couple of spots here in this cycle, places where the uh, infection cycle can be broken. So um, somebody that is contaminated, you need to be scrupulous in your sanitation, constantly washing hands, uh, trying to limit the number of people around that individual. Equipment is another source for contamination, uh, like things like colonoscopies or other kinds of equipment that is going in and around the mouth and things can, from either direction, maintaining good sterility there. Um, the antibiotics can work. It's a bit of a problem in the trying to uh, reduce these with antibiotics, and in turn, it can um, aggravate it as well. One of the solutions is something that we see here in the lower right corner. Uh, that's not some kind of like It looks like it could be a sausage, but no, these are syringes that are filled with a fecal material, and that we have something that is known as a fecal transplant, which essentially what you're doing is recolonizing the bacteria load in the gut. And it is a fairly successful process that is generally done with pretty severe cases of recurring infections. Okay, so that's where we are with the GI tract. Again, the best course for this is probably to start making a list of the bacteria and what they're doing, so you can have that as a reference. We'll be continuing on and getting into some more diseases and things, and then also get into some discussion of virology here in the next week or so. Uh, Hopefully we get the grades on the exams going before too long. It'll be next week, I bet, before I get them up. All right, so that's all I know. I'm home, but obviously I'm available by email, and I'll check in. Hopefully we'll be back at the lab uh, by the end of this week or early next week. So good luck, and we'll talk on Friday, one way or the other. You guys take it easy, and I will see you. I'm out.